Now we will discuss about the brachial plexus. Plexus means network, a network of nerve which gives supply to upper limb. This is brachial plexus. First of all, I would like to make a diagram. This is a diagram of spinal cord. This is ventral horn, this is dorsal horn. Here is ventral root and this is dorsal root. Here is pseudo unipolar ganglion. Now this is spinal nerve. So this is ventral root of spinal nerve, this is dorsal root and this is spinal nerve. Suppose this is section of at level of C5 vertebra. So this nerve is C5 nerve. Here is next nerve is C6 nerve. Here is C7, C8 and T1. Here is C6, C7, C8 and T1. This is T1 spinal nerve. And as you know, the spinal nerve gives two ramus, dorsal ramus and ventral ramus. Here is dorsal ramus. So each spinal nerve has dorsal ramus. This is dorsal ramus. This is dorsal ramus. Dorsal ramus. So this portion is ventral ramus. This part is ventral ramus of. This is ventral ramus of C5. Ventral ramus of C5. This is ventral ramus of C6. This is ventral ramus of C7. This is ventral ramus of C8. Ventral ramus of T1. And another thing, here is sympathetic ganglion attached to each spinal nerve. And a chain is formed. This is sympathetic chain. Now brachial plexus. Brachial plexus has four parts. It has a root. So this ventral rami of C5, C6, C7, C8 and T1, it forms a root. This is a root. This part is root. From here to here, this ventral ramus forms the root of the brachial plexus. Root of the brachial plexus. Root. And root of the C5 and C6 join to form upper trunk. C7 continue as middle trunk. C8 and T1 join to form lower trunk. So these roots arrange to form trunks. So here three trunks are formed: upper, middle and lower. This is upper, here is middle and this is lower trunk. Again, these trunks divides into dorsal division and here is ventral division. So this is ventral division, this is ventral division, this is ventral division and these are three dorsal divisions. 1, 2, 3. Upper trunk divides into dorsal and ventral, middle trunk divides into dorsal and ventral, lower trunk divides into dorsal and ventral division. So this part is division. Now upper division of upper, ventral division of upper and middle trunk join to form lateral cord. This is called, so here cords are formed, so this is lateral cord. This is lateral cord. Dorsal division of upper, middle and lower trunk, all three join to form posterior cord. So this is posterior cord. This is posterior cord. And ventral division of lower trunk continue as medial cord. So three cords are formed: lateral, medial and posterior cord. So brachial plexus is formed by root, trunk, division and cords. It has four components: root, trunk, division and cords. Now we'll discuss about the branches of these parts. This C5, root of the C5, C6, C7 join to form nerve to serratus anterior. This is nerve to serratus anterior. This is also known as long thoracic nerve of Bell. This is nerve to serratus anterior. It is formed by root of C5, C6, C7. And the root of C5 also gives one nerve, that is nerve to rhomboideus or dorsal scapular nerve. So this is nerve to rhomboideus or dorsal scapular nerve. Now trunk. This trunk, upper trunk gives a branch superiorly. This is nerve to suprascapular. This is nerve to suprascapular. And here it gives nerve to subclavius. Subclavius. So upper trunk gives two branches, two nerves, that is suprascapular and nerve to subclavius. This middle trunk gives no branches, lower trunk gives no any branch. Now division gives no any branch. Now in cords, lateral cord gives three branches: lateral pectoral, this is lateral pectoral, then musculocutaneous, and this is lateral root of the median nerve. Here is median nerve, median. This is lateral root of the median nerve. So lateral cord gives three branches. You can remember it like L, M, L. Lateral pectoral, this is lateral pectoral, M for musculocutaneous, and L for lateral root of the median nerve, lateral root of median nerve. This is lateral root of the median. This is lateral root of the median nerve. Now medial cord, branches of the medial cord. Medial cord gives five branches. Medial pectoral, this is medial pectoral. Medial cutaneous nerve of arm, medial cutaneous nerve of forearm, ulnar nerve, and medial root of the median nerve. So this is median nerve. It has two roots, lateral root comes from lateral cord, medial root comes from medial cord. तो ये है medial nerve. It has two roots, lateral root and medial. So medial cord gives 5 branches. You can remember by M4U. There are 4 M: medial pectoral, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median, and ulnar nerve. Now we will discuss about the branches from posterior cord. Posterior cord, this is posterior cord. It gives 5 branches. These are upper subscapular, thoracodorsal, nerve latissimus dorsi, lower subscapular, axillary, and continuous radial. This is radial nerve. You can remember this. Ulnar, ulnar, U-L-N-A-R, ulnar. Upper subscapular, lower subscapular, nerve to latissimus dorsi or thoracodorsal, axillary and radial nerve. So these are branches arises from the brachial plexus. So remember, brachial plexus has 4 parts: root, trunk, division and cord. And the roots are arise from C5, C6, C7, C8 and T1. In some cases, this whole system may shift one segment towards the upward. That means this brachial plexus arises from, in spite of C5, C4, C5, C6, C7 and C8 with little contribution of the T1. This condition is known as prefix. Prefix. In some cases, sometimes this whole system may shift inferior side. That means it, in spite of C5, it starts from C6, C6, C7, C8, T1 and T2. That condition is known as postfix. Postfix brachial plexus. So this is all about the brachial plexus. Yes, now we'll discuss about the Erb's palsy or upper trunk injury. First of all, we make a diagram of the brachial plexus. Here is ventral rami of C5, ventral rami of C6, ventral rami of C7, ventral rami of C8, ventral rami of T1. C5 and 6 join to form upper trunk. This part is root and this part is trunk. This is upper trunk. C7 continue as middle trunk. C8 and T1 join to form lower trunk. This is lower trunk. This is upper, middle and lower trunk. Then there is division. There is posterior division of all 3 trunks. Join to form posterior cord. And here is ventral division or anterior division. Join to form lateral cord. This is lateral cord. This is posterior cord. This is posterior cord. And its ventral division form medial cord. And here, this part is division. So, brachial plexus has root, trunk, division and cords. These are the parts of brachial plexus. Now, if you see here, here is a branch that is suprascapular nerve. This is suprascapular nerve. Here is nerve to subclavius. This is suprascapular nerve and nerve to subclavius. This part is known as Erb's point. This part is Erb's point. Here 6 nerves meet. Root of C5, root of C6, suprascapular, nerve to subclavius, and dorsal division and ventral division of upper trunk. So these 6 nerves are meet here. This is known as Erb's point. In case of undue abduction of head from shoulder, or if there is any condition which may cause excessive angle between the head and shoulder, this angle is if excessive, then it may pull this part and this part may rupture or damage. So muscles are the structure supplied by the branches of these nerves become affected. So typical presentation of the Erb's palsy patient is medially rotated upper limb, adducted, medially rotated, and elbow joint is extended, and forearm is pronated. And this type of deformity is known as policeman tip deformity, or waiter's tip deformity, or porter's tip deformity. I will discuss about the region, why this is adducted, medially rotated, and this part is extended, and this part is pronated. Why it is adducted? Because abductors are paralyzed. Here abductor, 0 to 15 degree abductor is supraspinatus, which is supplied by suprascapular nerve. And 15 to 90 degree abductor is deltoid, which is supplied by axillary nerve, which root value is C5 and C6. This is the reason why the abductors are paralyzed and this part is adducted. And another thing, medially rotated, because lateral rotators are paralyzed. Which muscles are lateral rotator? These are supraspinatus, infraspinatus, and teres minor, which are attached with posterior part of greater tubercle of the humerus. So all 3 muscles are supplied by root values C5 and C6. Supraspinatus and infraspinatus supplied by suprascapular nerve, and teres minor is supplied by axillary nerve. All 3 nerves root value, all 2 nerves root value is C5 and C6. So this is a region why hand is medially rotated, and the region why it is extended, because flexors of the elbow joint are paralyzed. Which muscle is flexor? Biceps brachii. Biceps brachii is supplied by musculocutaneous nerve, and root value of musculocutaneous is C5, C6 and C7. C5 and C6 affected. So biceps brachii action become affected. So due to palsy of this muscle, this joint become extended. And the region pronation, again due to palsy of the biceps brachii, the forearm is pronated. This is supinator muscle. If supinator is paralyzed, then part become pronated. So this is all about the Erb's palsy.